My name is Dr. Kristen Wright. I'm the medical director of the New Hampshire Fertility Center at Boston IVF. I see patients here in Bedford, New Hampshire. I'm also the assistant clinical professor at Dartmouth Medical School. Today we're talking about National Infertility Awareness Week, so we're going to cover the 5 things that are important for you to know when you come in to visit your fertility specialist for the first time. One of the initial questions that your fertility specialist is likely to ask you is about your menstrual cycles to determine whether or not you're ovulating. So we will ask you what your cycle length is, usually timed from start of one period to start of the next period. There's a couple different ways you can tell whether or not you're ovulating. There are kits that you can buy at the drugstore that test your urine hormones to determine when you're ovulating, and those can be helpful to use. You can also just track your period. If you're getting a consistent cycle that lasts between 24 and 35 days, that's a good sign that you're most likely ovulating, especially if you can tell when you're going to get a period. If you get symptoms before that time or symptoms around the time of ovulation, like a change in cervical mucus, that also suggests that you're ovulating. So your fertile window is the time when your body is ready and receptive for pregnancy, when the egg is ready to go in the fallopian tube and ready to be fertilized by the sperm. The egg is usually released from the ovary about 14 days before you get your next period. So if you have a 28-day cycle, you're usually releasing the egg about day 14 of that cycle. If you have a longer cycle, like a 35-day cycle, then you're going to be releasing that egg a little bit later, again about 14 days before you would be expected to get your next period. You are most fertile before you ovulate, so it's best to time relations a couple of days before that ovulation is actually happening. So if you're ovulating about day 14, starting to time relations about on day 12 of your cycle would be optimal timing for you. Patients often ask us about lifestyle factors that can help them to conceive, and there's a number of lifestyle factors that are important for you to consider. Having a healthy diet is important for everybody. Most physicians describe what's referred to as a Mediterranean style diet. That type of diet usually involves getting protein from lean sources of protein as opposed to fatty meats, fresh fruits and vegetables, whole grains as opposed to simple sugars, and getting fats from plant sources as opposed to animal sources. So to the extent that you can have a healthy diet most of the time, understanding that nobody has a perfect diet all of the time, but those are definitely something that you can focus on while you're trying to conceive. Regular physical activity is important for everybody in terms of both physical and emotional health. That doesn't have to be something elaborate, just going to the gym, just going for a walk every day is totally fine and appropriate for that. It's important to be on a good quality prenatal vitamin that has at least 800 micrograms of folic acid within it. Folic acid prevents a specific type of birth defects in babies called a neural tube defect, and that does start to form very early in the pregnancy, so it is something that we want in your system before you conceive. You should avoid toxic exposures, so those are things like smoking and drug use obviously should be avoided while you're trying to conceive. Alcohol should be enjoyed really in moderation, and then you should stop drinking altogether once you become pregnant. Caffeine, we do recommend to keep that in moderation. Less than 200 milligrams of caffeine per day is recommended during pregnancy. That's usually 1 or less caffeinated beverages per day. Infertility is much more common than people think that it is. About 85% of couples will become pregnant on their own within a year of trying, but about 15% don't. So about 15% of the population has infertility. There are various reasons for that. Male factor or sperm reasons can make up about 1/3 of cases. There's various female factors that can cause infertility that make up about 1/3 of cases. And sometimes we don't have a perfect answer as far as what's causing the infertility, but fortunately there's still treatments available even in that case. So you should see a fertility specialist if you've been trying to conceive on your own and you're not having success. For women under the age of 35, we recommend to try for about a year, and if you're not pregnant at that time, you should seek advice from a fertility specialist. If you're over the age of 35, we'd recommend that you seek an evaluation sooner, so after about 6 months of trying to conceive. There are some situations where it's certainly useful to see a fertility specialist earlier than that. So if you're not having a regular menstrual cycle on your own, then you're not releasing an egg regularly, and it's really unlikely that you're going to get pregnant on your own. So if your cycles are irregular, seeking advice from a fertility specialist sooner would be in your best interests. A normal regular menstrual cycle is between 24 and 35 days. So if you're consistently shorter or longer than that, then that would suggest that you're not ovulating, and you should seek help sooner. Thank you for joining us as we bring more awareness to this very important topic. Many couples out there are struggling with building a family, and you're certainly not alone, and we're here at Boston IVF to support you. Please check out our calendar for more events as we celebrate this important week.